Hi, my name is Dr. Amee Daxini and I'm a dermatologist. So I hear this question very frequently that doc, the skin in my underarms or thighs or around my neck is extremely dark or darker than the rest of my body. Is this normal? I'm sure many of you face the same thing. So let's discuss today the causes, the treatment, and understand why this exactly happens. So let's understand the causes of darkening of skin around your thighs or underarms or areola. The first is the mechanical cause. It's because of friction or chafing. When you wear tight clothing or you wear, clothes which do not help the sweat to get absorbed in these areas, that can cause irritation and subsequently increases the melanin production and you get pigmentation. Second is physiological causes like hormone changes. When you attain puberty, that's the time melanin production increases because of the hormone influence. So you start noticing the areola becoming darker, the underarm and the groin becoming a little darker than what they were originally. Third, it could be a genetic variation. Like Indians and Africans, we have a Fitzpatrick skin type 4, 5, and 6. Here, the basal melanin production is much more. So, in areas where there is overlap of skin, it tends to feel a little darker than the rest of the body. The next cause could be due to certain abnormal changes in the body, and the commonest is insulin resistance, which causes Acanthosis Nigricans. Now, what this exactly means is that in the folds, the skin becomes thicker, it looks velvety and much darker than the rest of the body. And this is because of glycogen deposition in those skin folds. This could be pre-diabetic or it could be due to certain other hormonal changes which need attention immediately. And last but not the least, is the reason could be due to the hair removal methods. The hot wax that we apply in this area can cause friction and subsequently can lead to pigmentation. Even repeated shaving with blunt razors, the amount of friction that you use can subsequently cause pigmentation. So be careful of what is happening, understand the cause, and accordingly get yourself treated. So it could be normal when there is a slight change in pigmentation in your underarms or your thigh or groin area. But it could be physiological, like during puberty or during pregnancy. It also could be normal when you have changed your lifestyle, like wearing tighter clothes or when it's hot and humid and there is chafing. But what it's not normal is when it suddenly starts becoming darker, when it's spreading, or the skin is becoming thicker in those areas and you start noticing skin tags. It's abnormal, especially in younger children, where it's darker around the neck, because that could suggest Acanthosis nigricans because of a pre-diabetic phenomenon. Sometimes, when it suddenly becomes dark, it could recommend or it could suggest hormonal imbalance, and last but not the least, fungal infection. So, if you see any of these things, you immediately visit your dermatologist. So there are many safe ways that you can lighten these areas, especially when it does not have an internal cause. First is change of lifestyle. Start wearing the right kind of undergarments so that it does not cause chafing and pigmentation. The second is moisturize, moisturize, moisturize. All these areas, although they are occluded, require moisturization for two reasons. One is to reduce friction, and second is to keep it hydrated. So remember, immediately after shower, do not forget to moisturize these areas and at night before you go to sleep. And in case the pigmentation is a little more, you could use certain products that contain lightening agents like azelaic acid, or you have glycolic acid in the milder proportion, kojic acid with niacinamide and ceramides to give a smoother skin. Last but not the least is if it does not work, these things do not work, please do meet your dermatologist, because there are certain in-clinic procedures that can help lighten these areas. You could do peels or you could do laser so that the pigment dispersion increases, and with a good lifestyle, you can maintain these areas in a better format. So while home remedies really help, especially in the initial stages, you should know what you should use. So like aloe gel, the one which has no color or fragrance, helps in calming the skin, especially when it's irritated, and can really work well to prevent pigmentation. You have also extra virgin cold pressed coconut oil or colloidal oats, which can calm the skin and prevent pigmentation. But what you need to avoid is things like turmeric, because turmeric can irritate the skin further, causing more pigmentation. Avoid using toothpaste or lime juice or even loofah or physical scrubs in those areas to reduce lightening, because subsequently they're going to cause more pigmentation. So generally, slight pigmentation in these areas is considered harmless. But in case the pigmentation suddenly is increasing, it is having an active border, the skin is thickening, there is oozing, burning, or irritation and severe itching in these areas, do consult your dermatologist. It could just be infection. And in case after home care remedies for 8 to 10 days you do not see any difference, it's advisable that you meet with your dermatologist and understand the cause and find the right treatment.